Good morning. Thank you for letting me come and listen to your presentation. I'm Tom Roman. I have a company and I do business with others with generating new products of software and electronics. And one of the things we do is test software for errors in static cases. So if you give me the source code software, I can tell you how many errors. So I'd like to know if you do test your software and how you test it and what are the number of errors per lines of code and what language you use. That will kind of give you an idea of how well your system works. Another thing that is doable in this world of developing products, software, and electronics is what they call FMEA, failure modes and effects analysis. In other words, what are the failure modes of your system, of your software and hardware together, or of your software or your hardware by itself individually, and what are the effects of those errors, and how are they attacked or handled in your system. Okay? FMEA, just you can search on the internet and find out all about it. Another thing is I'm very concerned about privacy and consent, and I really don't think nothing should be done without patient consent. Absolutely. The person, the individual person, citizen is the starting point of all rights and should remain with them. And we have the 10th Amendment to the U.S. Constitution, which says if there are things not given to the federal government by the U.S. Constitution, it remains with the state and the people themselves. So I think this issue is a people issue. People should be given permission to use their data. They own it. God created people with their own data as part of their being and should be kept that way. Another thing is, how are you going to handle political ramifications of different political bodies being in power? In other words, are you going to stick to the law as your agreements might affect your interaction, or are you going to be swayed by the various political dominations that come along as we see in our governments and in our society today? They're being persuaded by billions of dollars being spent on ads on TV, and people are just pounded with errors and misinformation. How are you going to handle that? Are you going to stick to the law, or are you not? And then I have a bunch of notes here. I just need to glance at them. But one thing that concerns me is that you can collect all this information, and what do you do if the person dies? Is it going to be erased or not? How do you handle archiving of information? How do you handle the archiving of your daily operations? Can you back up things? Because hard drives fail after 5 years. If you get a solid state hard drive, it also fails after so many years. So kind of like an archive plan, a backup plan, a protection of privacy plan. Those are all kinds of things that I'm concerned about. What other states are you servicing with your plans or your anticipated plans? What do you do with the data if your company fails? That's possible. A lot of companies are failing nowadays. We don't like to think about it, but it does happen.
Yeah, quickly, I'll try and touch on as many as I have the ability to answer. As far as from a testing perspective and code itself, well, I'm not a technical expert to be able to answer all the questions as you've asked them very precisely. We do take testing very seriously. We have a series of processes that we go through when we develop new code and implement new software, including our internal development testing as well as the quality assurance process that we go through. We test the actual code itself as well as doing regression testing on the system that is implemented and running transaction volumes through to not only identify where errors are occurring but also to be able to address performance of the implementation of that code. Knowing that many of these systems are real-time, it's important for us to understand what implications it has on the requester when they're asking for information and how quickly we're able to deliver. As far as the number of errors in our code and all the different types of software development that we do, I don't have those answers for you. I do know, that many of our applications are written both in C# as well as we have some Java code. We have many different sources because of the different applications that we're running and the origination of a lot of the systems that we have. We rely on many different developers and both internally written and external software. The RLS service that we're talking about is a software that we're purchasing that we're not writing ourselves, but it integrates into our service, so we do the full testing that I mentioned earlier. As far as the FMEA, I'm not familiar and wouldn't be able to intelligently answer that question, unfortunately. You've brought up some really good questions about your concerns about privacy and security, just like the previous question. And again, just to reiterate, we do take that very seriously, and we do share your comments as far as the patient should have consent. We have given the consent for that information. We expect that they have. It is a consent that is required at the time that the patient is receiving services. And if that consent is not given, then that information is not submitted through, and we don't have information to share with others because there was never a consent. So the consent is on both sides. We have consent to deliver information, but more importantly, the consent has to be there to be able to offer the information as well.
I think that's
the majority of this.
That was the majority of questions. Thank you, Mr. Roman.